Now, for us to actually, how would I say, for us to attain a very accurate imaging of a patient that came to the radiology lab for one or two imagings, there are some common steps that you have to follow. Either if you are using X-rays, CT scan, MRI, PET scan, any type of imaging for any part of the body, there are some common steps, okay, that if you want to achieve success in any one of them, is common to them, okay. So common steps for radiographic procedure include, so first, you have to identify your patient and you have to verify your patient. I don't know if you understand. You have to identify that, okay, they send the right patient to you and the imaging they are requesting is the right thing they are requesting. I don't know if you'd like easy. You can't, let me say, they send the wrong patient to you and the instructions with you is you are supposed to image that patient, maybe on the brain. Now, if you don't verify, you end up imaging that patient that didn't even need that imaging. Do you understand? So make sure that the name, the date of birth, hospital number, everything is accurate. Then also verify the examination request and all of that. So patient preparation. This way, at least you don't handle the patient as if the patient is an animal. At least you have to converse. How far I'm this. You introduce yourself. So this is the radiology department. You were sent from your ward and we are supposed to do so procedure. You understand? So during this procedure, these are the things that will happen. You also make sure that they have removed any jewelry. They don't have keys in the pockets and all of that. You provide the special gowns. Okay, those are all those gowns that are disposable. For the radiology. So you also follow the as low as reasonable achievable rule, which here you are trying to make sure that you are getting the right image for your diagnosis, and as you are getting that image, you are trying to make it in the interest of the patient. You are trying to make sure that the radiation is just little, so use all those shields and all of that. Okay, you are using shield because you want to reduce the amount of exposure that the patient will be exposed to. That's the radiation energy exposure. Then ensure that all the staffs around and the bystanders are protected from the radiation energy. Position the patients well, which on the next we'll be talking a lot about all those positioning in radiography. So also, if you are to use anything to keep the part of the patient immobile, okay, if this will aid you in getting a clearer image, then use it. So equipment setup, this is where you now set up, check out for the best exposure for the patient, and all of that. So also exposure, if it's around the chest, you know when to tell the patient to breathe in, you know when to tell the patient to breathe out. Okay. So imaging process and evaluation is you review the image for quality and ensure that everything is okay and can be used for diagnosis before you send this patient back. Then repeat it only if necessary. And of course, you have to be careful from the onset to avoid these repetitions. So after the procedure, don't just leave the patient. You have to assist them back to their comfort. They also document everything that happened within that procedure.